The theme of my talk is healthy pregnancy. Before I discuss pregnancy, let me talk initially about anatomy and physiology. Two branches of science, anatomy and physiology, provide the foundation for understanding the body's parts and functions. Anatomy is the science of body structures and the relationships among structures. Whereas anatomy deals with the structures of the body, physiology is the science of body functions, how the body parts work. The levels of organization of a language provide a useful comparison to the levels of organization of a human body. Your exploration of the human body will extend from some of the smallest body structures and their functions to the largest structure, that is an entire person. From the smallest to the largest size of their components, 6 levels of organization are relevant to understanding anatomy and physiology. The chemical, cellular, tissue, organ, system, and organismal levels of organization. The chemical level includes atoms, the smallest units of the matter that participate in chemical reactions, and molecules, 2 or more atoms joined together. At the cellular level, molecules combine to form cells, the basic structural and functional units of an organism. Cells are the smallest living units in the human body. Among the many kinds of the cells in your body are smooth muscle cells, nerve cells, and epithelial cells. The next level of structural organization is the tissue level. Tissues are groups of cells and the materials surrounding them that work together to perform a particular function. There are just 4 basic types of tissues in your body: epithelial tissue, connective tissue, muscle tissue, and nervous tissue. At the organ level, different kinds of tissues are joined together. Organs are structures that are composed of 2 or more different types of tissues. They have specific functions and usually have recognizable shapes. Examples of organs are the stomach, heart, liver, lungs, and brain. The next level of structural organization in the body is the system level. A system consists of related organs that have a common function. An example is the digestive system, which breaks down and absorbs food. Its organs include the mouth, salivary glands, pharynx, that's throat, esophagus, stomach, small intestine, large intestine, liver, gallbladder, and pancreas. Sometimes an organ is part of more than one system. The pancreas, for example, is the part of both the digestive system and the hormone-producing endocrine system. The largest organizational level is the organismal level. An organism is any living individual. All the parts of the human body functioning together constitute the total organism. That's one living person. The 11 systems of the human body include integumentary system, skeletal system, endocrine system, cardiovascular system, lymphatic and immune system, respiratory system, digestive system, urinary system, and reproductive system. Reproductive system components include gonads, that's testes in males and ovaries in females, and associated organs, uterine tubes, uterus and vagina in females, and epididymis, ducts, deferens, and penis in males. The functions include gonads produce gametes, that is sperm or oocyte, that unite to form a few organisms. Gonads also release hormones that regulate reproduction and other body processes. Associated organs transport and store gametes. Basic life processes. Organisms carry on certain processes that distinguish them from non-living things. Following are the 6 most important life processes of the human body. 1. Metabolism. 2. Responsiveness. 3. Movement. 4. Growth. 5. Differentiation. And 6. Reproduction. Reproduction refers either to the formation of a new cell for tissue growth, repair, or replacement, or to the production of an individual. Through the fertilization of an ovum by a sperm cell, life continues from one generation to the next. When the life processes cease to occur properly, the result is death of cells and tissues, which may lead to death of an organism. Clinically, loss of the heartbeat, absence of the spontaneous breathing, and loss of brain function indicate death in the human body. Homeostasis is the condition of equilibrium in the body's internal environment. It occurs due to the ceaseless interplay of all the body's regulatory processes. Homeostasis is a dynamic condition. In response to changing conditions, the body's equilibrium point can change over a narrow range that is compatible with maintaining life. Each body structure, from the cellular level to the systemic level, contributes in some way to keeping the internal environment within normal limits. Homeostasis in the human body is continually being disturbed. Some disruptions come from the external environment, that's outside the body, in the form of physical insults such as intense heat or lack of oxygen. Other disruptions originate in the internal environment, that's within the body, such as a blood glucose level that is too low. Homeostatic imbalances may also occur due to the psychological stresses in our social environment. The demands of the work and school, for example. In most cases, the disruption of homeostasis is mild and temporary, and the responses of the body cells quickly restore balance in the internal environment. In some cases, the disruption of homeostasis may be intense and prolonged, as in poisoning, overexposure to temperature extremes, or severe infection. Under these circumstances, regulation of homeostasis may fail. About 200 different types of cells are the basic units that compose human body. Each cell is a living structural and functional unit that is enclosed by a membrane. All cells arise from existing cells by the process of cell division, in which one parent cell divides into two new daughter cells. In your body, different types of cells fulfill unique roles that support homeostasis and contribute to the many functional capabilities of the human organism. The reproductive system. The male and female reproductive organs work together to produce offspring. The female reproductive organs contribute to sustaining the growth of fetuses. Sexual reproduction is the process by which organisms produce offspring by making germ cells called gametes. After the male gamete, that is sperm cell, unites with the female gamete, that's known as secondary oocyte, an event called fertilization. The resulting cell contains one set of chromosomes from each parent. Males and females anatomically distinct reproductive organs. Males and females have anatomically distinct reproductive organisms that are adapted for producing gametes, facilitating fertilization and in females sustaining the growth of the embryo fetuses. Gametes literally mean spouses. The male and female reproductive organs can be grouped by function. The gonads, testes in males and ovaries in females, produce gametes and secrete sex hormones. Various ducts then store and transport the gametes, and accessory sex glands produce substances that protect the gametes and facilitate their movement. Finally, supporting structures such as the penis and the uterus assist the delivery and joining of the gametes, and in females the growth of the fetus during pregnancy. Spermatogenesis produces about 300 million sperm per day. Once ejaculated, most do not survive more than 48 hours within the female reproductive tract. A sperm cell consists of three structures highly adapted for reaching and penetrating a secondary oocyte: a head, a midpiece, and a tail. Semen is a mixture of sperm and seminal fluid, a liquid that consists of the secretions of the seminiferous tubules, seminal vesicles, prostate, and bulbourethral gland. The volume of semen in a typical ejaculation is 2.5 to 5 milliliter, with 50 to 150 million sperm per milliliter. When the number falls below 20 million per milliliter, the male is likely to be infertile. A very large number is required for successful fertilization because only a tiny function ever reaches the secondary oocyte. The organs of the female reproductive system include the ovaries, the uterine fallopian tubes or oviducts, the uterus, the vagina, and external organs, which are collectively called the vulva or pudendum. The mammary glands are part of the integumentary system and also are considered part of the female reproductive system. The female gonads are the two ovaries, one on either side of the uterus, that are the size and shape of unshelled almonds. The ovaries produce gametes, secondary oocytes that develop into mature ova, that's eggs, after fertilization, and two, hormones including progesterone and estrogens, the female sex hormones, inhibin and relaxin. During development, the ovaries arise from the same embryonic gonadal tissue as the testes. When two organs have the same embryonic origin, they are said to be homologs. The formation of gametes in the ovaries is termed oogenesis, whereas spermatogenesis begins in the male at puberty. Oogenesis begins in females before they are even born. Oogenesis occurs in essentially the same manner as spermatogenesis, with meiosis taking place and the resulting germ cells undergoing maturation. Females have two uterine or fallopian tubes or oviducts that extend laterally from the uterus. The tubes, which measure about 10 centimeters, that is 4 inches long, and lie between the folds of the broad ligaments of the uterus. They provide a route for sperm to reach an ovum and transport secondary oocyte and fertilized ova from the ovaries to the uterus. The funnel-shaped portion of each tube, called the infundibulum, is close to the ovary but is open to the pelvic cavity. It ends in a fringe-like projection called femori, one of which is attached to the lateral end of the ovary. The uterus, also called as womb, serves as part of the pathway for sperm deposited in the vagina to reach the uterine tubes. It's also the site of implantation of a fertilized ovum, development of the fetus during pregnancy and labor. During reproductive cycles, when implantation does not occur, the uterus is the source of menstrual flow. The vagina is a tubular 10 centimeter or 4 inch long fibromuscular canal lined with mucous membrane that extends from the exterior of the body to the uterine cervix. It is the receptacle for the penis during sexual intercourse, the outlet for menstrual flow, and the passageway for childbirth. Situated between the urinary bladder and the rectum, the vagina is directed superiorly and posteriorly, where it attaches to the uterus. A recess called the fornix surrounds the vaginal attachment to the cervix. When properly inserted, a contraceptive diaphragm rests on the fornix, covering the cervix. The perineum is the diamond-shaped area medial to the thighs and buttocks of both males and females. It contains the external genitals, and anus. The perineum is bounded anteriorly by the pubic symphysis, laterally by the ischial tuberosities, and posteriorly by the coccyx. The two mammary glands, that's breast, are modified pseudoriferous, that's sweat glands that produce milk. They lie over the pectoralis major and serratus anterior muscles and are attached to them by a layer of deep fascia composed of dense, irregular connective tissue. Each breast has one pigmented projection, the nipple, that is a series of closely spaced openings of ducts called lactiferous ducts, where milk emerges. The circular pigmented area of the skin surrounding the nipple is called areola. It appears rough because it contains modified spacious glands. The female reproductive cycle. During their reproductive years, non-pregnant females normally exhibit cyclic changes in the ovaries and uterus. Each cycle takes about a month and involves both oogenesis and preparation of the uterus to receive a fertilized ovum. Hormones secreted by the hypothalamus, anterior pituitary, and ovaries control the main events. The ovarian cycle is a series of events in the ovaries that occur during and after the maturation of an oocyte. Steroid hormones released by the ovaries control the uterine, that's menstrual cycle. A concurrent series of changes in the endometrium of the uterus prepare it for arrival of a fertilized ovum that will develop there until birth. Gonadotropin releasing hormone secreted by the hypothalamus controls the ovarian and uterine cycles. Gonadotropin releasing hormone stimulate the release of follicle stimulating hormone, that is FSH, and luteinizing hormone, that is LH, from the anterior pituitary. FSH in turn initiates follicular growth and the secretion of estrogens by the growing follicles. LH stimulates the further development of ovarian follicles and their full secretion of the estrogen. Estrogens secreted by follicular cells have several important functions. Estrogens promote the development and maintenance of the female reproductive structures, secondary sex characteristics, and the breasts. Estrogens increase protein anabolism. Estrogens increase protein anabolism, including building strong bones. Estrogens lower blood cholesterol level. Progesterone, secreted mainly by cells of the corpus luteum, acts synergistically with estrogens to prepare and then maintain the endometrium for implantation of a fertilized ovum and to prepare the mammary glands for milk secretion. Phases of the female reproductive cycle. The duration of the female reproductive cycle typically ranges from 24 to 35 days. A duration of 28 days is divided into 4 phases: the menstrual phase, the pre-ovulatory phase, ovulation, and post-ovulatory phase. During heterosexual sexual intercourse, sperm are ejaculated from the male urethra into the vagina. The similar sequence of physiological and emotional changes experienced by both males and females before, during, and after intercourse is termed the human sexual response. During the first decade of life, the reproductive system is in a juvenile state. At about age 10, hormone-directed changes start to occur in both sexes. Puberty is the period when secondary sexual characteristics begin to develop and the potential for sexual reproduction is reached. Onset of puberty is marked by pulses or bursts of LH and FSH secretion, each triggered by a pulse of gonadotropin hormone. Most pulses occur during sleep. Most pulses occur during sleep. As puberty advances, the hormone pulses occur during the day as well as at night. The pulses increase in frequency during a 3 to 4 year old, during a 3 to 4 year period until the adult pattern is established. The stimuli that cause the gonadotropin releasing hormone pulses are still unclear, but a role for the hormone leptin is starting to unfold. In females, the reproductive cycle normally occurs once each month from menarche, the first menses, to menopause, the permanent cessation of menses. Developmental biology is the study of the sequence of events from fertilization of a secondary oocyte to the formation of an adult organism. From fertilization through the 8th week of the development, the developing human is called an embryo, and this is the period of the embryological development. Fetal development begins at week 9 and continues until birth. During this time, the developing human is called a fetus. One sperm and a secondary oocyte have developed through meiosis and maturation, and the sperm has been deposited in the vagina. Pregnancy can occur. Pregnancy is the sequence of events that begins with fertilization, proceeds to implantation, embryonic development, and fetal development, and normally ends with birth about 38 weeks later or 40 weeks after the last menstrual period. Pregnancy is divided in 3 trimesters. The first trimester is the most critical stage of the development, during which the rudiments of all the major organ systems appear, and also during which the developing organism is the most vulnerable to the effects of drugs, radiation, and microbes. The second trimester is characterized by nearly complete development of organ systems. By the end of this stage, the fetus assumes distinctively human features. The third trimester represents a period of rapid fetal growth. During the early stages of this period, most of the organ systems are becoming fully functional. Preparing to become pregnant. So you think you want to be a mom, at least sometime in the near future. How exciting! Having a child is a wonderful experience that will enrich your life forever. But the decision to have a child shouldn't be taken lightly. Parenthood is a lot of work, And the best way to approach it is by preparing yourself so that you are as ready as possible for this big event. When it comes to pregnancy, thinking ahead can give you and your baby the best possible beginning. If you are to become pregnant, is the time right? When your friends with children tell you to say goodbye to lazy weekends and impromptu night outs and hello to nighttime feedings and loads of baby laundry, they aren't kidding. Having a baby is life-changing. In most ways it is wonderful, but life will never be the same. Although there is probably never a perfect time to have a baby, some phases of your life may be more conducive to pregnancy and new parenthood than others. How to get pregnant? Face it, some couples seem to get pregnant simply by talking about it. For others, it takes plenty of patience and a bit of good fortune. If you are wondering that the best approach is to becoming pregnant, you need to know. Conception is based on an intricate series of events. Every month, hormones from your pituitary gland stimulate your ovaries to release an egg. Once the egg is released, it travels to the fallopian tube to encounter any sperm that may be present. Your fertile period is the period of time when egg and sperm are most likely to meet. This window of opportunity is governed by two factors: the lifespan of a sperm inside the woman's reproductive tract. It is no more than 5 days. The even shorter lifespan of egg is 24 hours. Your best chance of becoming pregnant is to have intercourse 1 or 2 days preceding ovulation. Maximizing your fertility. To increase your chances of being successful when you are trying to conceive, some simple do's and do nots are: make healthy lifestyle choices. Have sex regularly. Have sex once a day near the time of ovulation. Consider preconception planning. Male fertility depends on sperm quality and quantity, which can be affected by a variety of factors. Men may not be able to control everything that could improve their fertility, but there are steps that can be taken to maximize fertility and help ensure male sperm are top performers. Take a multivitamin, eat plenty of fruits and vegetables, reduce stress, get regular exercise, be weight conscious. Are you pregnant? Early symptoms. For some women, early signs and symptoms of pregnancy begin in the first few weeks after conception. Don't get too hung up on early symptoms, though. Some can indicate that you are getting sick or that your period is about to start. Likewise, you can be pregnant without experiencing any of these symptoms. Tender, swollen breasts, fatigue, slight bleeding or cramping, nausea with or without vomiting, increased urination, food aversion or cravings, headaches and dizziness, mood swings, raised basal body temperature. Choosing a birthing location. When deciding on a care provider, you might also think about where you want to have a baby. This decision is often closely tied to your choice of a care provider and where he or she practices. Some women choose to give birth at a birthing center or in their own homes. Hospital. Most of today's hospitals treat children less like a medical procedure and more like a natural process. Many hospitals offer a relaxed setting in which to have your baby, with options such as birthing rooms, rooming in, family-centered maternity care. Issues to consider. The age of 35 is often viewed as the critical age when it comes to getting pregnant. While the biological clock is a fact of life, there is nothing magical about the age of 35. It is simply an age at which certain factors become worthy of discussion. For example, pregnancy may take longer. A multiple pregnancy is more likely. Risk of gestational diabetes is increased. Chances of a C-section are increased. Risk of chromosomal abnormalities is increased. Risk of miscarriage is higher. Making healthy choices. Steps toward a healthy pregnancy are the same for women aged 35 and older as for younger women. To reduce your risk of complications and help ensure a healthy pregnancy at an older age, seek regular care, choose a healthy lifestyle, avoid risky substances, read up on prenatal testing. Healthy choices during pregnancy. A new baby on the way is a great reason to take stock of your current lifestyle. Pregnancy provides many women with the motivation to eat well, exercise more, and minimize risky habits. And if you make healthy habits a priority now, it will be that much easier to maintain them after the baby arrives, meaning you will lose weight faster, have more energy to devote to your new baby, and get back to your old or new and improved self in a record time. Pregnancy diet. During your pregnancy, you will be eating for two, you and your baby. But don't think of this as eating twice as much. Instead, think of it as eating twice as well. If your diet isn't exactly settler, you enjoy junk food, you tend to skip meals, or you eat a limited variety of foods, start making changes now. In fact, it is a good idea to make healthy eating a part of your pregnancy planning from the start. Most of your baby's major organs form during the first few weeks of pregnancy. Eating well helps create ideal conditions for early fetal development. Over the course of your pregnancy, there are certain nutrients you will want more of too, such as iron, calcium, folic acid, and other essential vitamins and nutrients. Making every bite count. There is no magic formula for a healthy pregnancy diet. In fact, the basic principles of healthy eating recommended for everyone apply to pregnant women as well. What are those principles? Eat plenty of fruits, vegetables, and whole grain. Choose lean protein and low-fat dairy products. And select a variety of foods. If you can remember these key principles, you and your baby will be well on your way to a balanced diet. Eating at least 3 smaller meals a day and making sure you snack on healthy foods is a good way to eat well and get the nutrients you need. Foods to avoid. During pregnancy, it's okay to eat most foods. However, there are certain foods you should stay away from or limit because they could carry a risk of unwanted side effects. The chances of a serious complication is small, but it is generally best to play it safe. Foods to avoid include seafoods high in mercury, raw, undercooked or contaminated seafood, undercooked meat, poultry and eggs, processed meats, unpasteurized foods, unwashed produce, large quantities of liver. If you are a vegetarian, you may wonder if your diet will cause any problem for your baby. To help avoid this problem, try the following. Eat at least 4 daily servings of calcium-rich foods. Add more energy-rich foods to your diet. Seek advice on supplements like B12 supplements, folate and folic acid, calcium, protein, iron. Gaining weight. So pregnancy is the one time in your life when you can gain as much weight as you want and not worry about it. There is no one size fits all approach to how much weight you should gain when you are pregnant. Healthy weight gain depends on a variety of factors including your pre-pregnancy weight and body mass index. Your health and your baby's health also play a role. If you are overweight, although excess weight carries risks such as gestational diabetes and high blood pressure, pregnancy isn't the time to lose weight. Even if you are overweight before pregnancy, it's important to gain a healthy amount of weight during pregnancy. If you are underweight, for women who are underweight, it is essential that they gain a reasonable amount of weight during their pregnancies, especially during the second and third trimester. Where the weight goes. Let us say your baby weighs in at 7 or 8 pounds at birth. That accounts for some of your pregnancy weight again, but you certainly will gain more than 8 pounds during your pregnancy. Where does the rest of the weight go? Here is a sample breakdown. Baby weight 7 to 8 pounds, larger breasts 1 to 3 pounds, larger uterus 2 pounds, placenta 1.5 pounds, amniotic fluid 2 pounds, increased blood volume 3 to 4 pounds, increased fluid volume 3 to 4 pounds, fat stores 6 to 8 pounds. If you start out a healthy weight, you need to gain only a few pounds in the first few months. Staying active. Pregnancy seems like a perfect exercise to sit back and relax, doesn't it? The fatigue, back pain and swelling sometimes associated with pregnancy all seem to be pointing you emphatically towards the couch. But the truth is that sitting around won't help matters. In fact, it is quite the opposite. Exercise can help lessen common pregnancy complaints such as back pain. It can boost your energy level and reduce your risk of gestational diabetes, pregnancy-related high blood pressure, and postpartum depression. Try to spend at least 30 minutes each day exercising. Walking is a great exercise. It provides moderate aerobic conditioning with minimum stress on your joints. Other good choices include swimming, rowing, cycling on a stationary bike. Low intensity yoga. Pregnancy is demanding. Consider some simple tips. Start small. Find a partner. Use a headset. Try a class. Get creative. Get yourself permission to rest. If you are a regular jogger, runner or swimmer, it is likely you will be able to continue these activities throughout most of your pregnancy with your care provider's consent. After the first trimester, it is best to avoid floor exercises that require you to be on your back for a long period of time. The weight of the baby can cause problems with blood circulation. Standing motionless for a long period of time also can be hard on the circulatory system. Pregnancy exercises. Childbirth is a wonderful experience, but the hours leading up to delivery can be a real workout. Your muscles and joints are moving and changing in all sorts of ways to make it possible for the beautiful little boy or girl to enter the world. You can make childbirth less demanding by preparing your body for what to come. During pregnancy, certain exercises help limber up those joints and muscles you will rely on during labor and delivery. Working while pregnant. When you become pregnant, going to work can seem like agony if you are dealing with morning sickness and fatigue. If your work situation allows it, you may want to lighten your schedule during the first 3 or 4 months of pregnancy. Once you move into your second trimester, things are likely to feel much better. During the third trimester, try to take it easy if you can. Handling fatigue. You may feel tired as your body works overtime to support your pregnancy, and resting during the workday can be tough. It may help to eat foods rich in iron and protein, take short frequent breaks, cut back on activities, keep up your fitness routine, go to bed early. Carrying around a growing baby can make everyday activities like sitting, standing, bending, and lifting uncomfortable. It can also cause constant pressure on your bladder, strain on your back, and fluid retention in your legs and feet. Emptying your bladder frequently can help relieve pressure. Moving around every few hours can ease muscle tension and help prevent fluid buildup. But you may need to try other strategies to make yourself comfortable throughout your workday and prevent potential health hazards. Pregnancy month by month. You have always known pregnancy to last 9 months, so why do we list 10 months? 9 months is the common measurement for pregnancy, but pregnancy does not divide itself evenly into months. In determining your due date and monitoring your care provider works from a 40-week calendar. This is 40 weeks. If you consider that most months are 4 weeks long, take 40 divided by 4 and that equals 10 months. In actuality, though, some calendar months are 5 weeks. Once your baby is conceived, he or she gets to work right away. The next step in the process is cell division. Within about 12 hours after fertilization, your one-celled zygote divides into 2 cells, and then those 2 each split into 2, and so on, with the number of cells doubling every 12 hours. The cells continue to divide as the zygote moves through the fallopian tube to your uterus. Within about 3 days after fertilization, it becomes a cluster of 13 to 32 non-specialized cells resembling a tiny raspberry. At this stage, your developing baby is called a morula. It now leaves the fallopian tube to enter your uterus. Within 4 to 5 days after fertilization, your developing baby, now made up of about 500 cells, reaches its destination inside your uterus. By this time, it has changed from a solid mass of cells to a group of cells arranged around a fluid-filled cavity and is called a blastocyst. At 14 days after conception, 4 weeks since your last menstrual period, your baby is about 1/25th of an inch long. It is divided into 3 different layers from which all tissues and organs will eventually develop. The first couple of weeks of your pregnancy were pretty much a breeze. In fact, they were kind of fun. All of the excitement that comes with finding out the big news. Well, get prepared this month. Things are going to change. During weeks 5 through 8 of your pregnancy, your baby cells multiply rapidly and they begin to perform specific functions. This process of specialization is called differentiation. It is necessary to produce all the different cells that make up a human being. As a result of differentiation, your baby's main external features also will begin to take shape. The second month of your pregnancy brings enormous changes for your body. It is the time you are likely to experience the discomforts and annoyances of early pregnancy, such as nausea, heartburn, fatigue, insomnia, and frequent urination. Coping with morning sickness. Morning sickness is one of the dreaded aspects of pregnancy. If you are lucky, you will escape it, but most women do not. Morning sickness refers to the nausea that occurs during pregnancy. Morning sickness affects an estimated 50 to 90% of pregnant women. It is most common during the first trimester and is characterized by nausea with or without vomiting. Signs and symptoms typically start at 5 to 8 weeks, sometimes beginning as early as 2 weeks after conception. They often subside by weeks 13 to 14. Treatment isn't usually needed for morning sickness, although home remedies such as snacking throughout the day and sipping ginger can help relieve nausea. Your emotions. Pregnancy is a psychological journey as well as biological one. You are still the daughter of your parents, yet soon you will be the mother of your own child. You will have a new role to play and a new identity. The emotions you are feeling in the face of this reality can be both overwhelmingly positive and distressingly negative. Prenatal checkup. The time is finally here to see your obstetrician. Your first prenatal checkup is an exciting time. This will likely be your longest and most comprehensive checkup. Therefore, allow plenty of time in your schedule so that you won't feel rushed. Your first prenatal visit with your care provider gives you a chance to review your general health and lifestyle and talk honestly about being pregnant and giving birth. To get the most out of your first visit, keep the following tips in mind. Be proactive, don't hold back, be honest. Sex during pregnancy. As long as your pregnancy is proceeding normally, you can have sex as often as you like, but you may not always want it. At first, hormonal fluctuations, fatigue and nausea may sap your sexual desire. During the second trimester, increased blood flow to your sexual organs and breasts may rekindle your desire for sex. But by the third trimester, weight gain, back pain, and other symptoms may once again dampen your enthusiasm for sex. Baby's growth. As you enter the second trimester, all of your baby's organs, nerves, and muscles are formed and beginning to function together. Growth continues at a rapid pace, but baby is still small at this point, less than 3 ounces. The fifth month often brings another joy of pregnancy. For many moms, it marks the first time they are able to feel baby moo inside. This movement often is greeted with relief. Feeling baby moo is an indication that all is well. Now, not only is your tummy getting bigger, but baby is tickling your inside. During the fifth month, your little boy or girl will start to fill out more. Gradually, he or she is beginning to look more like the child you dream about. Baby is still very small though. As you near the halfway point of your pregnancy, the child inside still weighs less than a pound. Sixth month marks the last full month of your second trimester. That means you are already 2/3 of the way there. Growth is now occurring at a more rapid pace. In fact, if your little girl or boy was born at the end of this month, he or she would have about a 50% chance of survival, and the odds get better with each passing week. Weeks 25 to 28. You are now on the home stretch. The last 3 months, actually 3.5 months of your pregnancy. And the word stretch is appropriate. These are the months that your baby will grow in size by measurable amounts, and yes, your tummy will stretch. Ninth month. This can be a busy month as you prepare your home, your life, and yourself for a new baby. It can also be a long month. The anticipation is tormenting you, and so you are back, feet, and most everything else. The discomforts of the late pregnancy may now reach their peak, but keep in mind that your perseverance and patience are soon about to pay off. These days, baby is gaining weight almost as quickly as you are, putting on about a half a pound a week. Your baby is big and may be disturbing your sleep. Your muscles are sore from carrying this large bundle. Put it all together and you are probably feeling tired most of the time. If you're worn out, take a break. Rest and relax with your feet up. Fatigue is your body's way of telling you to slow down. Your emotions. You are probably thinking a lot this month about when labor will start and how your childbirth experience will go. A growing sense of tension during this time is understandable, as are worries and fears about whether your baby will be healthy. You may also be spending some time contemplating what the pain will be like during childbirth. Preparing yourself for labor. It is to be expected that you may feel anxious about labor and childbirth, but realize that women go through labor and give birth every day. It is a natural process. To help you prepare and stay calm, educate yourself. Talk with women who have had positive birth experiences. Tell yourself that you will just do the best you can. Familiarize yourself with the various pain relief options available to you during labor. Weeks 37 to 40, month 10th. Pregnancy is only supposed to be 9 months. What is going on? In case you have forgotten, pregnancy is officially considered complete at 40 weeks. In these final weeks, your uterus finishes expanding and baby gets plump. During the final weeks, weight gain varies. Weight gain varies depending on the child. Some babies put on more weight than others. Labor and childbirth. The last weeks of pregnancy may feel like a time of waiting and waiting. This is especially true if your baby is overdue. As you anticipate the start of labor, it may seem as if time is standing still. So what do you do while you wait for that little one to arrive? Get ready. Here is a to-do list. Review your birth plan. Pre-register at a hospital. Pack your bag because your due date isn't given. It is a good idea to have your bag packed and ready for the hospital ahead of time. Try to relax. As you are making final preparations for your baby's arrival, your body is preparing for labor and delivery as well. As labor approaches, your body undergoes certain changes that signal that your baby likely will be born soon. Labor signals some of the changes to watch for include lightening. As you approach your due date, you may feel that the baby has settled deeper into your pelvis. This natural step is called lightening. Lightening may be noticeable to you. Braxton Hicks contractions. Throughout your second and third trimester of pregnancy, you may experience occasional, usually painless contractions, a sensation that your uterus is tightening and relaxing. These false labor pains are called Braxton Hicks contractions, and they are your body's way of warming up for labor. Bloody show. During pregnancy, the opening to your uterus, that cervix, is blocked by a thick plug of mucus. This plug forms a barrier between your cervix and vagina so that bacteria can't enter your uterus and cause an infection. A few weeks, days or hours before labor begins, this plug may discharge and you may have what is called bloody show. Thinning and softening of cervix. One sign that labor is starting is that your cervix begins to thin, efface, and soften, ripen in preparation for delivery. Dilation of the cervix. Your obstetrician also may also tell you that your cervix is beginning to open, dilate. Dilation is measured in centimeters, with the cervix opening from 0 to 10 centimeters, 4 inches during the course of labor. Thinning, softening, and dilation of the cervix often precede other signs of the labor. Breaking of water. At some point during labor, the bag of water's amniotic sac housing your baby begins to leak, or it breaks, and the fluid that has cushioned your baby flows out of your vagina in a trickle or a gush. Contractions. At the beginning of the labor, the uterus begins to squeeze, contract. These contractions are what move your baby down the birth canal. Labor pains or contractions often begin with cramping or discomfort in your lower back and abdomen that doesn't stop when you change position. Over time, the contractions become stronger and more regular. Stages of labor and childbirth. Labor is a sequence of events or a process that takes place over the span of an hour to as long as 24 hours or more. How long your labor will last depends on many factors. As a rule, labor is usually longer with first babies. That's because the openings of uterus, that cervix, and birth canal, that's vagina, at first time mothers are less flexible, and therefore it takes longer for labor and birth. For women giving birth for the first time, labor usually lasts between 12 and 24 hours, with an average of 14 hours. For women who have given birth before, labor usually lasts between 4 and 8 hours, with an average of 6 hours. How long labor lasts and how it progresses differs from woman to woman and from birth to birth. Labor is formally divided into 3 natural stages. Stage 1 occurs when the uterus on its own opens the cervix to allow descent of the baby. Stage 2 is pushing and delivery, the birth of your baby. Stage 3 is delivery of the placenta after birth. The first stage of the labor is the longest of the stages and is itself divided into 3 phases: early labor, active labor, and transition. Stage 2, the birth of your baby. Once your cervix is fully dilated and you are instructed to, you can push. It isn't unusual, especially with first-time mothers, to have to push for an hour or two before the top of your baby's head appears, crowns, at the opening of your vagina. It may still take another few minutes and few pushes to deliver the baby. After you push the baby's head out, you will probably be instructed to stop pushing for a moment while your doctor makes sure that the baby's umbilical cord is free. Immediately after birth. At birth, your baby is still connected to the placenta by the umbilical cord. Often, the parents can assist with the clamping and cutting of the cord. Immediately after birth, your baby may be placed in your arms or on your abdomen. Eventually, your baby is weighed and examined. Stage 3, delivery of placenta. After your baby is born, a lot is happening. You and your partner are celebrating the excitement of the birth. You are likely both decompressing, relieved that labor and childbirth are finally over. Meanwhile, a doctor in the background is examining your baby as he or she takes the first breaths, and you hear those wonderful first cries. The third and final stage of labor and childbirth is delivery of the placenta. The placenta is the organ inside the uterus attached to the baby by the umbilical cord. It is the organ that has nourished your baby throughout your pregnancy. Caesarean birth. There are times when giving birth the natural way isn't the best option. Caesarean delivery, commonly known as a C-section, is a surgical procedure used to deliver your baby through an incision in your abdomen rather than vaginally. Latest figures indicate that caesarean deliveries now represent about 30% of all births. There are many different reasons why caesarean births are performed. Sometimes the decision to have a C-section has to do with the mother's health, while other times it is related to concerns about the baby. Sometimes the procedure is done when both mom and baby are healthy. This is called an elective C-section, and it is controversial. Indications for C-section include labor isn't processing normally, baby has an abnormal heart rate pattern, baby is in a difficult position, baby's head isn't ideally positioned, you have a serious health problem, you are carrying multiples, there is a placental problem, there is an umbilical cord problem, baby is very large, baby has a health problem, you have had a previous C-section, you were newborn, baby is finally here. The wait is over. For the last 10 months, you have spent endless hours in preparation and anticipation of the day you would look into your baby's face. And now that day is here. Your labor and delivery, whether it was a marathon session or shockingly short, is behind you. Now is the time to hold, caress, and enjoy that precious little person you have been waiting for so long to meet. Newborn care. From the moment your little one is born, he or she is the focus of much activity. Your care provider or a nurse will clean his or her face to make sure your baby can breathe properly. The nose and the mouth are cleared of fluid as soon as the head appears, and again immediately after birth. While baby's airway is being cleared, his or her heart rate and circulation can be checked with a stethoscope or by feeling the pulse in the umbilical cord. All newborns look somewhat bluish grey for the first several minutes, especially on their lips and tongue. By 5 to 10 minutes after birth, they become pink. Your baby's umbilical cord is clamped with a plastic clamp, and you or your partner may be given the option to cut it. In the next day or two, many things will take place. The medical team will conduct newborn examinations, administer screening tests, and give immunizations. Taking baby home. Finally, the moment you have been anticipating is here. You are bringing home the newest member of your family. You have set up the crib and nursery, bought and borrowed cute little outfits, and stocked up on diapers, wipes, blankets, and other supplies. You have been thinking about all of the changes this new baby will bring to your life, and you are likely feeling both excited and scared. Your baby's world. During the first few weeks of the newborn's life, it may seem like all he or she does is eat, sleep, cry, and keep you busy changing diapers. But your baby is also taking in the sights, sounds, and smells of his or her new world, learning to use his or her muscles and expressing a number of innate reflexes. As soon as babies are born, they begin to communicate with you. Infants can't use words to communicate their needs, moods, or preferences, but they have other ways of expressing themselves, especially by crying. Baby care basics. Once your son or daughter is home, you may wonder about even the little things. Am I holding him or her right? Is this outfit too tight or too hot? Is the bath water too cold? It is normal to feel a little nervous or anxious. But it won't take long until you are a pro. You will soon become a whiz at everything from changing diapers to giving your little one a bath. You have to hold your baby in a proper way. Issues for mom. After having your baby, you may wonder if your body will ever return to normal. Take heart. It will. But it does take time to recover from the changes that occurred over the previous 10 months. It is not realistic to expect to bounce back quickly after giving birth. But over time, you will start to feel better physically and get back in shape. Breastfeeding. Clearly, breast milk is best, and the benefits of breastfeeding are well established. Breast milk contains the right balance of nutrients for your baby, and the antibodies in breast milk boost your baby's immune system to help fight disease. But sometimes breastfeeding isn't possible. Feeding your baby formula instead of breast milk shouldn't lead to feeling of guilt. Feeling guilty isn't good for you or your baby. Feeding your newborn is about more than just nourishment. It's a time of cuddling and closeness that helps build the connection between you and your baby. You want to make every feeding a time to bond with your baby. Find a quiet place to feed the child, where you are both less likely to be distracted. Cherish the time before your baby is old enough to start feeding himself or herself. That time will come soon enough.